This is the chapter on sleep and its effect on performance, featuring Dr. Chris Winter, Medical Director at the Martha Jefferson Hospital Sleep Medicine Center.
Let's talk now about sleep and how it affects players at the 16 and under and the 18 and under levels, and how your understanding of sleep can make you a more effective coach. In this age group, players have in many ways reached their adult patterns of sleep. Furthermore, most players who remain in the sport have demonstrated a level of commitment to get them to this point. The degree of competition is high, and that comes with changes that often include more significant travel and a more intense level of play. There will be players who continue to play hockey beyond this level, and their development needs to be considered. For these high-level players, coaches need to understand how to elicit the most out of their teams. Coaches also need to be able to identify and neutralize aspects of sleep and travel and sleep disruption that could affect the way his or her team plays. One unfortunate topic that usually surfaces at this time is that of alcohol and other drugs. Not only are these substances harmful from a health and behavior perspective, they are extremely harmful in terms of sleep quality and athletic performance. This is ironic as some individuals use drugs like alcohol to help them fall asleep. What they do not understand is that alcohol and other substances actually worsen sleep quality. Coaches should talk about these issues with their players and let them know that elite hockey and alcohol use do not go together. The link between elite performance status and avoidance of substances and behaviors that impair performance should be clearly conveyed. At this age, players may be more able and willing to play with injuries. Often pain is more easily ignored on the ice than it is in the bed. Medications and treatments are often focused on pain alleviation during game and practice time and largely ignored at night. Coaches need to take into consideration how the discomfort might affect players' sleep and the toll this may take on the individual's performance the following day. Furthermore, there is emerging research suggesting that sleep dysfunction might diminish a young player's recovery from an injury. Travel will often start to become more of a factor in hockey for players of this age group, at times perhaps involving travel between time zones. It is important for coaches to know how travel will affect individual players and the team as a whole, especially since the ability to travel with enough time to allow players to acclimate to their new environment is often limited. When a team's ability to travel ahead of the game to allow for acclimation is limited, there are many methods that may be useful in preparing players to play their best in that time zone. Adjusting practice times, meal times, and sleep times can be extremely helpful, as well as light exposure times. Light exposure prior to travel can be useful strategies to trick players' brains into thinking that travel has already occurred. Careful planning of meal times during travel, coupled with fasting during travel across multiple time zones, may hasten acclimation and improve performance. Healthy insomnia treatment and prevention continues at this age group. Regular dialogue between coaches and players about the way they are feeling and the way they are sleeping should be established. Getting players into a routine off of the ice, with their sleeping and their meals, is as important as the routine and rituals on the ice. Over-dependence on pharmacological treatment of insomnia should be avoided. At this age, for more elite-level players, a more detailed analysis of sleep can be performed. This type of analysis might be geared towards determining the athlete's optimal sleep amounts. Does the player need 7.5 hours of sleep per night or 8.5? Furthermore, sleep timing optimization might be looked at as well. If he needs 8.5 hours of sleep, is he better off sleeping from 11 to 7:30 or 10 to 6:30? This later evaluation of what we determine as chronotype is important as it often impacts player performance during travel. Chronotype can also be manipulated to produce a more resilient player. At this age, for more elite level players, a more detailed analysis of sleep can be performed. This type of analysis might be geared toward determining the athlete's optimal sleep amount. Does the player need 7.5 hours of sleep per night or 8.5? Furthermore, sleep timing optimization might be looked at. If he needs 8.5 hours of sleep, is he better off sleeping from 11 p.m. to 7:30 a.m. or 10 p.m. to 6:30 a.m.? This later evaluation of chronotype is important as it often impacts player performance during travel. These and other variables can also be manipulated to produce a better hockey player. Whatever role hockey plays in the player's future, the knowledge of sleep you've imparted on your players will serve them not only their future hockey careers, but also in their lives.
That completes the video portion of this segment. Now let's move on